What you have in your packet, as the council knows, every year, and I hope my memorandum was at least somewhat self-explanatory. As you know, in the past, we have always tried to get our numbers for health insurance renewal, which is a benefit that's provided to city employees by the city of Moscow. Currently, that benefit for insurance covers health insurance for the employee and half of the cost of insurance that is extended to that employee's dependents. In the past, our plan year started November 1st of each ensuing year. So by the time we were preparing the budget in February and March and April, we had only November, December, January, February, maybe 4, maybe 5 months of the plan year. There was no way that the insurance company could, who has been Regents Blue Cross, or Regents Group, not Blue Cross, that's a different company.
Regents Blue Shield.
Regents Blue Shield of Idaho. Used to be located in Lewiston, now they're in Salt Lake City. However, so what we would typically get is some, because they were assessing their risk, they would send us quotes of 15%, 18%. We would negotiate with them. We keep asking for updated numbers because the insurance, they have two things that go into their consideration or used to. That was medical inflation, or what they call trend, and the experience or the usage of the medical insurance by the employees. Those two things determined what your rate increase would be year to year. We've seen rate increases within the past 10 to 12 years. Some have been as high as 23%. We've had a couple of 10%, 13%, so on and so forth. But we've been very fortunate in the past several years that those increases have been right around 5 to 6%. I would note that according to Helbling Employee Benefits, who is our health insurance consultant, that medical inflation is going up anywhere from 5 to 10% per year, depending on the service, and that prescription medications is going up at a much higher rate than that. So we're seeing quite a bit of inflation for medical care. In addition, the Affordable Care Act, which is now being the cost of that is now being implemented through the state. We have, I don't want to say through the state, I'm sure the legislators wouldn't appreciate that, but the federal government is dictating that we budget for that. And that alone, the costs affiliated with the Affordable Care Act are just shy of 4%. So we're seeing about a 4% inflationary factor just from the cost of the Affordable Care Act. Okay, bring us full circle. A year and a half ago in the FY 2014 budget, we were able to negotiate with Regents to give us a 20-month extension, or a 20-month plan year, if you will, that would remove the November 1st date and would move that date to August 1st, which means that by the time we start working on our budgets, we've got 7 or 8 months of experience, and we're able to start estimating a lot closer. So that renewal, I think, was 5.9% last time it was negotiated. So this year we received a notice from Regents when we made inquiry of 12.1%, and that was based on experience, not just the ACA costs, but trend, inflation, all that sort of thing. But there was quite a bit of utilization by the employees and dependents. So we kept watching, as was our instruction from council. We went out to RFP and asked other carriers. The two major other carriers in the area are Blue Cross and Pacific Source. They gave bids, if you will, or quotes for the same coverage or similar coverage. Some of it isn't as similar as we would have liked. Pacific Source came in higher than the Regents quote. Blue Cross came in about 3% less. However, for a different type of package, so it's a different type of benefit than what is provided today. So Regents, in making their quote, also gave an alternative renewal option, which was discussed as well. That was given to us at 7.8%. We then requested that the other carriers were asked to respond to that alternative renewal option as well. They did. Pacific Source chose not to respond. Blue Cross did respond, and they came back at 4%. In the world of health insurance, apparently they get to look at it several different times because Regents came back and said, well, we can do it for 4.9% for medical. However, that also presupposes that you will also renew your vision and dental plans, which the actual inflationary factor was higher. So it worked out to 5% across the board. So what they have essentially indicated is that they will give the alternative renewal option, which if you go to, and I'm sorry, it is page, we can look at page 59 in your packets. I gave you a copy of a lot of the information that was provided, but suffice it to say that if you look under that column that says current, that is currently the benefit that is provided at this point, and the quote which was given to us, a final quote for services as is at 11.2%. As we indicated, that was not something that, as staff, we felt was a very good deal, so we then started the process I just explained. The alternative renewal is the differences in coverage as well as the cost, which was, as I indicated, is 4.9%. The difference basically, and I've presented this to the Employee Benefits Committee, the Employee Advisory Committee, and made a presentation to an all-city employee meeting as well. Staff understands that the cost of health insurance is fluctuating, that it's going up, and like anyone else, they aren't particularly pleased that the benefit is changing. However, realistically, they understand that we have to seek out alternatives. So the changes, as you can see, are fairly shifts a little bit of the risk to the employees. The deductible stays about the same. There are different deductibles for out-of-network. Obviously, Blue Cross, Blue Shield, and Pacific Source try to have healthcare providers negotiate with them for the cost of services, and that's what the health insurance pays for a service. And if it's in network, the health insurance or the health provider accepts that as the cost of the service, and the patient does not pay any additional money. If you're out of network, they do not have an agreement, and Blue Cross, Regents, or Pacific Source will pay what they believe is the appropriate cost, and the patient then is responsible for anything over that. So obviously staying in network makes good sense. However, that is changing a little bit, that there will be additional deductible for out-of-network. I've just been informed by Helbling Employee Benefits that when you start talking about out-of-pocket maximums, they have actually reduced what they said would be the maximum out-of-pocket maximum. So that helps us. I'm waiting for mailing on that.
Oh, excuse me, Gary.
Yes.
It's going to be less than what's shown on page 59?
It is, because of the $3,000 prescription maximum down below, yes, it will affect it, Walter. I'm not sure exactly what that is because I haven't received the mailing.
So it's going to be less?
That's my understanding.
Okay.
Okay. It will be no more than what you see on this paper, but it's supposed to be less. The office visit has gone from $20 to $25. I would note that we have been, at least Helblings has indicated to us from Regents, that we have almost no one who goes out of network. So it's in network that we're really looking at. So the experience of the city is that most employees stay within the network. One of the things, and the big difference, as I indicated, Blue Cross's proposal was 4%, but they also had some coverages that they did not provide. For instance, they did not cover acupuncture or naturopath. We have a significant number of employees who participate in those sorts of treatment, but Blue Cross, they would not be covered. The copay for emergency room would go to $50 to $100. There is a maximum out-of-pocket for prescriptions at $3,000, which actually a couple of years ago we did have an out-of-pocket maximum. For 2 or 3 years, that went away. So actually, as you paid more prescriptions, you paid the amount of money, but you could pay $5,000 out of pocket, and it's still, you would continue to pay the copay. So the changes are fairly minimal, although it puts a little bit of risk back on the employee, and that is 4.9% or 5% across the board. Understand that The Blue Cross was 1% less than Regents. We've been with the Regents for 20 years. I don't know how many times that Helblings and I have gone back to Regents and said, look, we've had a relationship for 20 years. Certainly we fluctuate a little bit, but that long-term relationship has got to be worth something. I'm convinced that it's gotten us some fairly good or fairly reasonable adjustments over the years. So I would recommend that we continue with Regents at 5%. Additionally, besides the potential savings of 1%, when you switch health insurance carriers, you're switching a lot of things. It's a big administrative issue. Was this benefit paid under this plan year or the plan year with the new insurance company? It's just not worth it. In discussing it with our former HR directors, both Leslie Moss and Debbie Klein-Robertson and Helbling Employee Benefits, if the difference was 3%, probably. If you saw you were consistently getting higher rates, 3% might warrant a reduction if you could get an assurance in writing from the new carrier that they would not jack the rate on you the next year, and they're just not what they call buying the business. So with that, staff's recommendation, the amount of money that is proposed in the FY 2016 budget is for the 5% health insurance increase to continue coverage as outlined on that page 59.
I want to throw something out here, because when this first came up, this 11.2, and Gary and I talked about it originally, it was real close to 12%. Gary and staff, others, got this thing whittled down and spent countless hours negotiating and getting this thing where it belongs. And I think this is a pretty doggone good package. I don't know how many times Gary and I talked about this in his office, a number of different times, and looked through it, and I think it's a very reasonable thing. I just thought I'd throw that out there to you guys because, it's saving a pretty good little chunk of dough there.
If I may, Your Honor.
$90,000.
One thing I forgot to mention, when we went to that August 1st plan year, I know our budget year starts October 1st. We understood that in order to get some better predictability and better numbers to build the budget, that there would be that 2 months that would overlap into the previous budget year. We calculated that up on what if it's 5%, what if it's 10%, what if it's 20%, and the council was, on the advice of staff, was comfortable in that 2-month overlap. So that's what you're seeing today. When you authorize me to go ahead with this, we will execute the document. We will be under this plan starting August 1st, and we will be committing in this budget year to go with this plan, which we budgeted for in the next budget year.
Walter?
Did you see what I just marked on my iPad? Is that the reason for your comment just now?
I mean, you must be sending out brainwaves, Walter.
So we're okay budget-wise to cover the 2 months of additional 5%?
Yes, sir.
Okay.
Other questions for Gary? Dan?
Having to deal with this in my regular gig and seeing the increases that we're seeing, I think that 5% is a hell of a swinging deal. So I would make a motion that we approve the alternate renewal option for health, dental, and vision insurance with Regents as set in the accompanying memo,
Second.
including the premium increase of 5%.
Okay, we got a motion by Dan and a second by Walter to approve the alternative renewal option for health, dental, vision insurance with Regents Group as more fully set in the accompanying memo that we have in front of us. I'll start with John.
Aye.
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 Okay, we move on to 6-0. Thank you, Gary, very much.